Hello, my name is Caitlin Chapman, and I chose to do my web of causation on PTSD caused from sexual abuse in children and adolescents. The problem being addressed is PTSD or post-traumatic stress disorder in children and adolescents who have experienced some degree of sexual abuse. Post-traumatic stress disorder is defined in the DSM-5 as a traumatic event that causes threat to the integrity of the person or others with the reaction of the individual characterized by intense fear, helplessness, or horror. A brief overview of the symptoms related to PTSD are fear, sadness, anger, low self-worth, and low self-esteem. Behaviors such as aggression, out-of-place sexual behavior, and self-harm can come through child's play. Also, re-experiencing may present itself in one or more of the following ways: intrusive recollections, recurring nightmares, acting or feeling as if the event was recurring, and distress when reminded of the event. PTSD is diagnosed by having two or more symptoms lasting more than 1 month following exposure to an extremely traumatic event, i.e., sexual abuse. Okay, moving on. Another determinant that I chose to write about and research on was incarcerated juveniles. And I found that adolescents who are incarcerated are at a much higher risk of experiencing some form of sexual abuse while in a juvenile facility. This could be either from a male or a female perpetrator. Youth who reported more than one incident of misconduct with more than one incident further reported more than 11 incidents of staff sexual abuse. Over 40% of youth said that staff was the instigator for the sexual conduct. A lot of the research showed that a lot of the female officers looked like or related to the children as a mother or a sister, and it made it easier for the female officers to prey and conduct sexual activities on the children in the facilities, which I found very interesting because I would have assumed more that it was male on male. Okay, and now we're going to move on to the next determinant, which was the perpetrators. And for this research, I looked at perpetrators who are in home and outside of home. So I found that child abuse cases are more likely to result from a family member as the perpetrator. The literature is inconsistent regarding the weight of the identity of the offender on the long-term negative psychological effects of PTSD. However, research did predict that when a perpetrator identifies as a family member, PTSD symptoms can be a lot more prevalent because the abuse relates to a person in which they trusted. There's also some more facts on the slide about this if you would like to read them, but I'm going to go ahead and move on to the next. Okay, moving on to the history of sexual abuse. Having merely just a history of sexual abuse is a determinant of PTSD caused by sexual abuse because it is more likely for re-victimization to occur. And when I say re-victimization, I mean that when a child has been abused once, it is a lot more likely that it will continue to happen until they have the courage to tell someone or the abuser stops. So this makes it a lot more likely, and usually the PTSD symptoms can be more severe because of the prevalence of the abuse. I'll give you some time to read this slide, and then I'm going to move on to the next determinant. Okay, the next determinant I found to be a risk factor for PTSD and sexually abused children was gender. I found that young adult females were more likely to experience sexual trauma than boys. These findings were consistent with a meta-analysis of gender differences in trauma experience of adults as well. Sexual abuse exposure has been linked to the likelihood of PTSD diagnosis for female youth, and it is shown that female children are also more likely to suffer from PTSD symptoms later in life. I found this really interesting because when I think of PTSD, I'm always thinking of mostly veterans and men and male figures. So it was very interesting to see that actually females tend to suffer more from PTSD than men. Okay, now that I have discussed my age determinants, I'm going to go ahead and move on to the web of causation. For my web of causation, I outlined the determinants of PTSD in children who have experienced sexual abuse. As you can see, the bigger circles are the determinants or risk factors that I outlined in my literature review section. Some of these circles have smaller subcategories. These subcategories are meant to make a picture or visualize a more specific relation to the health issue that may put the child at risk for PTSD caused by sexual abuse. So, for example, if you look at the SES circle or socioeconomic status, you can see that there are subcategories of high income and a lower income. But I put a red arrow to the health issue because a high income area was shown to be more prevalent for sexual abuse versus a lower income area. However, that's not to say that lower income areas do not experience sexual abuse. I just want to make it clear that the high income areas are a higher risk for it. And this stays true to all the other 7 determinants and their subcategories if they have them. And the red arrow that points to the health issue and how it relates. Okay, now moving on to social work perspective, which are very important. So I wrote, as a social worker, it is imperative to assure that the sexual abuse victim seeks out some appropriate resources. This can be counseling, therapy, group counseling, any kind of intervention to help address the trauma that has related to PTSD and the symptoms as soon as possible. It is also important that the social worker engages in staying up to date with current research about PTSD related to sexual abuse, specifically before engaging with this sensitive population. And I think this kind of stems off what I just said, which is the ethical obligation of a social worker to participate in continuing education. This can be through seminars, trainings, their own research, consulting with colleagues. So the social worker can maintain an up-to-date on new therapeutic practices and interventions relating to PTSD and sexual abuse. Some of the treatments I found that licensed and clinical social workers have the ability to do is use a form of treatment or intervention called trauma-focused cognitive behavioral therapy for a continuing period of at least 6 months. I've done a lot of research in prior classes that has dealt with PTSD in children relating to sexual abuse, and it is always, the literature almost always shows that trauma-focused cognitive behavioral therapy is the best intervention to use. And as a social worker, we have the ability to practice and work with this intervention with children who have experienced PTSD or caused by the sexual abuse. Okay, now moving on to a community-based perspective. The name of a community-based program that I found was called Safe Horizon, and the population in which it targeted was any child or adult who has been affected by sexual abuse. The targeted goals of the community-based program was to help heal and recover the body and spirit after a child or adult has experienced a rape or sexual abuse. It operates by providing individual and group counseling, workshops, support, and practical assistance and information to victims of sexual assaults and their families. There is no literature revealing if the community program has been effective thus far. However, general research does show that the method Safe Horizon is using are effective in the prevention of PTSD later in life and can help one to overcome the traumatic experience. Okay, a policy that I found that actually is nationwide now is the HB 406 called Aaron's Law. The population group that this policy targets is children's grades kindergarten K through 12. What are the targeted goals of this policy? Well, in Georgia, the goals are to provide age-appropriate courses on sexual abuse and assault awareness, also prevention, education in kindergarten through grade 12. They give a manual setting out the details of such course of study shall be prepared by or approved by the state school superintendent in cooperation with the Department of Public Health, the State Board of Education, and such expert advisors as they may choose. So although this is not directly relating to PTSD, I believe it's important in the prevention of PTSD when a child or an adolescent can utilize these skills they learned through the Aaron's Law. Has the policy been tested for its effectiveness? After doing some research of this policy, I did not find any data that's suggesting that the policy has been tested for its effectiveness as of this year. All right, now we're on the last slide, and it's just going to be a conclusion of everything that I have learned through my web of causation. So children who are sexually abused are at a significantly greater risk for later post-traumatic stress disorder and other anxiety symptoms. PTSD related to sexual abuse can affect anyone. However, there are determinants that may put them at a higher risk, and these are the same ones that I discussed in the lit review. And these are culture, having an intellectual disability, family, and further on the family is, as we discussed earlier, sexual abuse is more likely to occur within the family than outside. Okay, so being homosexual, having a higher SES, having a history of sexual abuse, being incarcerated, and being a girl. Research has shown that it's important to seek therapeutic help as soon as possible after a sexual trauma has occurred, and this is to help prevent severe PTSD resulting from the trauma later in life. If you or anyone knows someone being sexually abused, it's very important that you guide them into telling somebody so the abuse can stop and the appropriate intervention and treatments can occur to further reduce the risk of PTSD later in life. Also, it was shown that cognitive behavioral therapy has been shown to be the most helpful intervention and therapy to use when PTSD occurs from childhood sexual abuse. And that's been my web of causation. It's definitely been a sad topic to research, but I think it's important that people understand PTSD does not only come from veterans or other life experiences, that sexual abuse is a huge cause for PTSD, especially in children. So I hope you enjoyed it, and thanks for listening.